Hi all, in today's class we are going to discuss one topic in fifth unit, that is no special sensory organ eye. So before getting into this topic, first we should know why we want to study this topic. What is the empathy part of this, right? So if you take empathy part, we might have come across so many eye disease and eye disorder, right? So in according to the statistical survey in 2023, the World Health Organization states that moreover 2.2 million people have been affected with the vision impairment and vision loss yearly. So out of this, 1 billion of people, just because of normal eye disorder like refractive errors and cataracts, they lost their quality of the life. So if you say like 36 percentage of people lost their impairment just because of refractive error, and only 70 percentage of people lost their vision impairment due to the cataract. Okay, so there are some other causes for eye disease also there. One such as age-related macular degeneration and glaucoma, diabetic retinopathy, infectious disease, that is some eye infections, and also there is some cancer. The trauma also will be there in the eye. So these are some other causes which leads to the eye disease. So there are if you take any eye disease, eye disorders, the potential of a recovering state is very based on the severity of the eye disease, right? So some can be reversible, some can be irreversible. So if we can improvise the quality of well-being by in terms of providing good vision to the people by in terms of giving better treatment at a earlier stage, right? So this is going to be the empathy part of this today's topic. So see here I have listed out like a major eye disease, eye disorder here. So these are the no, this one is a normal case, and these three or four abnormal eye disease cases. If you see the cataract, you know what is mean by cataract? This is nothing but is a cloudy lens. The people usually have normal lens. This lens allows all the light to make fall on the retina so that we can have the proper vision, right? So in case of cataracts, the lens will be like cloudy. It's been built up with some protein. So normal vision, the people won't have the proper clear vision. Okay, so as a result, they will have blurry vision. So like glaucoma is nothing but it's and the people have damage at nerve, and macular degeneration is damage at retina. That is the macular part in the retina, and retinal detachment is the tear of retina. So these are different cases of eye disease. So here I have given how does the eye appears in physically, and how the physiological of eye appears, that is the back of the eye photo, and how does these people can see the world. So here the third column is how does the people see the world. What is the difference between difference between the normal people vision and also the diseased people vision, right? So these are the empathy part, right? So like as a biomedical engineer, we need to contribute something to address this problem, right? So in terms of developing some device or designing some device in order to identify some disorder at the earlier stage, or to in order to have prevention at the earlier stage, so that we can give some quality of life for the people, right? See, these are the glimpse of some innovation done by the engineers like us. So here I have listed out few of things: the fundus photography, and we have a bionic eye. It's one of the artificial eye. We can also say the artificial eye. We supported the people who partially are fully blinded. Okay, and also we have a direct ophthalmoscope, PR supported direct ophthalmoscope, and you have a portable ultrasound probe, and then self-adjustable glasses. So we said no refractive errors, that is the normal disorder. We have some people have a short sight, long sight problems. So this glass will self adjusted by itself based on their power of their eyes. Okay, then we have the app also, and then we have a I handbook smartphone app to have a routine follow up and checkup of healthy status over of eye, and we also have the simulation for a cataract surgery, so that the doctors can train well before they get into the cataract surgery. So as a result, they will success in that surgery. So these are the fleet glimpse of the innovation in cardiac surgery. So as so what I would like to convey here in the sense, so if you have the empathy part very strong, what is a problem, then we need to do some miracle in such case, means we need to strong in our base also, right? So that is the main objective of this class. Now we are going to discuss the basic of eye. This means the structure and function of the eye, and here we will also covers the what are the parts which is present in the eye, how does the normal eyes works. Okay, so if you know the basic only, we come to know where the problem lies and what is the problem, and once we define the problem, then we will come up with so many innovation, right? So let's start with the basic one, that is the introduction part of eye. So we know, as all we know, the eye is the it's a beautiful organ, it's a sensory organ, it's responsible for the normal vision. Okay, so you can see any objects or anything with help of the sensory organ, that is the eye. Okay, so its structure is, it's spherical in shape, about 2.5 centimeter in diameter. It is located in orbital cavity in the face, and it's been supplied with optic nerve, that is a second cranial nerve. So if you take the structure of the eye, there are other, it's mainly covered with three layers. Okay, so outer fibrous layer and middle vascular layer, and third one is inner nervous tissue layers. So if you take outer fibrous layer, it covers the two parts, sclera and cornea, and the middle vascular layer, that is choroid layer, which covers the parts ciliary body, iris and lens, and third inner nervous tissue layer is nothing but retina. Yes, let's see one by one before getting into just observe what is the structure of eye. Okay, so this is the overall structure, the anatomy of the eye. Yes, so if you see here, this is the white part. This white part is nothing but is the outer layer of the eye. It is the sclera. The post, it will cover the posterior part of the eye, and then front part, the anterior part of the eye is covered by a layer called cornea. Okay, so the cornea and sclera is the outer layer of the eye. The back side of the eye is covered by sclera, and the front part of the eye is covered by cornea. And then next to that sclera, the second most layer is nothing but a choroid layer. This choroid layer is the middle layer. It's been innervated with so many blood vessels, and in front these choroid is attached with the ciliary bodies, and the ciliary bodies, it's being attached with, on one side it supported the lens, in other side it will supported the pupil. The black colored one is nothing but is the pupil, right? And then you also have this sky blue color. The color part of the eye is it's your iris. Color part of the eye is nothing but is your iris. Okay, then you have the muscles, that is the ciliary body, which actually supported your pupil and lens. So it controls the amount of light entering into the eyes. And then other part is an innermost layer. Okay, the thin innermost layer is nothing but is the yellowish layer is nothing but a retina. It is the major part of eye. So here we have so concentration of rods and cones. So it's meant for color vision and night vision. Okay, and then the point, this is the point, it's called optic disc, or you can also say blind spot. Is the part where the optic nerves start and gets attached to the brain. Okay, and then this front chamber is called anterior chamber, and the back side of the chamber is called vitreous chambers. It is being built with some solution, that is aqueous solution and vitreous solution. So through this only the eye pressure is being maintained, and also the nutrients is being supplied to the eye. Yes, this is the overall picture of anatomy of the eye. Yes, and then one more part is this one, this flagella like membrane is nothing but is a conjunctiva that is lined front part of the eye, and also the inner part of the eyelid. Okay, let's discuss each part in detail. So let's first we will start with sclera. The sclera, as I said, it is the posterior covering, outer covering of the eye. So we can see the white part of the eye is nothing but sclera. It is made up of tough white skin. It is that is the fibrous tissue. So the main function of this sclera is it supports the eyeball and it give supports for muscles, that is the scleral bodies. And next part is the cornea, that is the front covering outer layer of the front part of the eye is the cornea. So it is in transparent in nature, so that it allows the light to pass getting into the eye. Okay, so it is in transparent in nature, whereas sclera is opaque in nature. So it is a white part of the eye, and front lens. It's like it's same. It seems to be like a lens. So that is nothing but is the cornea. So the function of cornea, as I said before, it just allows the passage of light into the eye, and also it helps to focus the light so that we can have proper vision. And then choroid is the in second layer, that is the middle layer of the eye is choroid. It is enriched with so many blood vessels, and so it's look like a chocolate brown in color. And the function of choroid is that so whatever the light is getting inside into the eye to reach the retina, the remaining light is being absorbed by the choroid. Yes, then iris. This is a color part. This is a sky blue color of the sky blue color part is nothing but iris. This is in eye also we have iris, which is color part. The main function of the iris is it will controls the light entering. Okay, it will controls the amount of light entering into the eye. So which helps to constrict the pupils and stimulate, I mean dilates the pupil based on that demand, whether like it will decide whether to send the more light or amount of light to be sent more or less. So based on that it will control the pupil whether to expand or dilate. Okay, so next one is the pupil, that is the black part of the eye is nothing but is a pupil. We can also say the black hole. This is the point through which light will get enters. This pupil size will also controlled by this iris, and along with the ciliary muscles, it's being attached with this iris and pupil. Okay, so the function is the hole which decide the amount of light to get inside the eye. So for example, if you want to see anything in the dark, you want to you consciously you will expand your eye in order to witness something, right? So in that case your people will get larger, so that it will allow the more light to get into the to enter into the eye, so you can see the things clearly. So whereas if you want to see anything in a bright in very bright, obviously you will shrink your eye, so the pupil will get shrunken, and so that it will allow the only less light to enter it, so that it will minimize the more amount of light getting into the eye. So this is nothing but the parasystematic and systematic action of your brain activity, that is a peripheral autonomic nervous system activity of autonomic system. So based on the environment setup, whether it is bright or dark, according to that your pupil will get stretch out or dilate, so that it will control the amount of light entering into the and will control the amount of light, that is enough light getting enter into the eye, so that we can could see proper vision. So next we will have the lens. This is the main part, because the light once the light getting into the eyes, it has a tendency to get refract. Okay, it will get scattered in all directions. So that with the help of lens, it is nothing but is a biconvex lens. So it will converge all the light, so that it will make fall only on the retina where the rods and cones are concentrate. So with these are nothing but the photoreceptors, which is meant for eye vision, color vision, right? So next, the function of lens is which enables based on the whether we are seeing near object or far object, with the help of the lens convex properties, we can able to see both no, because of this flexible lens. Then final, the third layer is nothing but is the retina. Yes, the retina is the innermost layer. It's a very important layer which is made for the color vision, where it contains light receptive cells, that is the photoreceptor cells, rods and cones. These cones are very highly responsible to convert or the lights into the electrical signals. That is the format, converting the light into the form where the brain can understand. Okay, so this after converting the electrical signals, these signals through optic nerve getting into the brain. So the brain at last we will interpret the image based on the information we gathered. Okay, so this is the structure of the eyes. Inside you have the rods and cones parts, and then this pit like depression is nothing but it's a fovea. So the fovea, we have only the concentration, more concentration of the cones, and whereas in other part of the retina is being occupied with the rods. Okay, so rods is mainly responsible for light vision, low light vision, that is in dark vision, whereas the fovea is responsible for color visions. So it act only in bright light. Okay, so these are things I discussed before, right? So the two types of photoreceptor cells, human eye, rods and cones. The rod photoreceptors is it's meant for black and white vision. It respond well in low light, whereas cone is the central vision. It's nothing but is a color vision. It respond well in medium and bright light. Okay, so the rods is mainly highly concentrated in the retina, whereas cones it's more concentrated in the area called macula. So around 6 millions of cones are concentrated in the fovea, and moreover 100 billions of rods are concentrated in the retina. Okay, the center at the center of the macula is a small depression called fovea. The fovea is nothing but, see here, a small pit depression. This part is called macula. This depression is called fovea. The fovea contains only the cone receptors. This is a point we can when the lights reach this point, we will have a very good clarity of the vision. Okay, that is a maximum visual acuity and the color vision. So function of the retina is thing is where to convert the light waves into the equivalent electrical signal, so that the brain will process further and interpret as a image what we want to see. And then spot is nothing but is a blind spot. Okay, the point where the optic nerve will start to emerge. It's the area. It's called blind spot. When the light falls on this spot, because this spot, when the light falls on the spot, the people can't see anything, because this is the spot where it doesn't contains rods and cones. Okay, so each eyes, it has the own blind spot, but these blind spots will be compensated by with the help of other each other. Okay, the function of the blind spot is it like what the small spot on the back of the retina, the other eye compensate for this area. So as I said, each eye, it has a blind spot. It's a spot where all the information will get gathered, and through optic from which the optic nerve will start to emerge, and then the information will all travel all around through the optic nerve. It reaches to the brain, and but this part doesn't have any rods and cones. So when the light falls on this particular part, the people can't see anything. So each eye have its own blind spot, but it will get compensated with each other. One eye, a blind spot will compensate it with the other eye. Okay, so next is optic nerve. So as I said, the optic nerve is the it's a medium through which the electrical impulse from the retina will reaches the brain, so that we can able to see the image what we would like to see. And so Next is aqueous humor. Aqueous humor and vitreous humor is a solution is it's present inside the eye. Anterior chamber is being filled with aqueous humor, and the posterior chamber of this chamber is filled with vitreous humor. So this humor is a fluid solution. It is mainly helps to supply the nutrients and bends the light, and it helps to maintain the shape of the eye. And whereas in vitreous humor, it also gives the better structure, eye structure, and also it helps to bend the light so that it all falls exactly on the retina. Yes, and these aqueous humor and vitreous humor should be in equalized in it should be in balanced in nature, so that the intraocular pressure will be maintained within the limit. Yes. So that's all about the main topic. That's in next class we will continue this with accessory eye structures. Thank you, guys.